My name is Alison Eyre, and I am the Director of Postgraduate Education in the Department of Family Medicine at the University of Ottawa. Why is it important that as doctors we are excellent collaborators? It's a very good question, because collaboration hasn't always been a big part of how we practice. But there's an enormous amount of research now coming out to say that in order to have excellent patient care, we need to have excellent teamwork. In order to be efficient in our healthcare delivery, we need to understand our roles and our responsibility, as well as the roles and the responsibility of everybody else who is involved in the patient care. This way, we can all work to the greatest of our strengths and maximize the efficiency of all of our colleagues working to the greatest of their strengths. Another important piece of the collaborator role is the whole idea around conflict resolution. Conflict resolution is a skill that we need to learn. It is not something that is innate for many of us, but it is a very important skill, and it is a skill that when we are good at, we can greatly help teams to be significantly more efficient. We can also help our patients in the teams with their families to be more efficient, because often when people are feeling very stressed, when they're unwell, when things aren't clear, conflict arises simply because we're unsure about where things are going. When physicians take a strong role in being good at conflict resolution, they greatly enhance patient care. Why is it challenging for us to act in the role of collaborator? I think one of the key things is that we're just not really used to it necessarily. Particularly as physicians, we've been trained to be very independent. We've often learned that if you want something done well, you just do it yourself. We like the hierarchy because it just makes life go smoother. The problem with that approach is that it doesn't work well in our team settings, and it does not provide good patient care. We need to learn to feel confident in our skills and to feel confident in the skills of everyone around us to support strong teamwork. There's often a fear involved in that, because if you work with others, they can see your weaknesses as well as your strengths. But this is part of why teamwork is so important, because if we look at it as the team makes a whole, that means that each of us is working to our strengths, and we're allowing the rest of the team to make up where the gaps are in our care. In my clinical setting, I work in a community health center where it is evident that our complex patients benefit from the collaboration of a multidisciplinary team. I value the collaboration enormously because it allows me to do my job to the fullest, knowing that all of the other aspects of the patient care are being done by the best team member. This way I don't worry. I also find that it really helps the patients, because once they understand each of our roles, they're often much more confident to tell the nurse or the receptionist something that they wouldn't want to tell me. When we work as a team, we provide the strongest patient care. This ebook will help you as a preceptor, as a physician, and as a teacher to help your learners to develop a competency in the collaborator role. This competency will guide them throughout their entire medical career and help them to be the strongest colleagues and the strongest advocate for patient care they can be.